bit slower results, but you can do on the lunch break. You can go there, get it done, come back and do your work. So that's something you might want to look into. That's real. It's already been done for many years. And I think the reason it got invented was that they saw that children who used to suck on the popsicles, they had like dimples in their cheeks. And they say, how come they have dimples that much? Because they burn the fat in the cheeks because of the cold in the mouth all the time. So then they use the same technology on the belly. You never know what are the long-term side effects are. So, but hey, if you got to use it at your home, I would just recommend put some ice in the bags and put it around your waistline and leave it alone. See what happens. Pretty much it's the same thing. I mean, they're doing in a controlled environment. You know, you're doing the same thing, but don't get frostbite in humor. How to explain that?
It's called cool sculpting.
Yes.
And they cost $700 per section. So
Per section?
Yes, for your belly and your love handles, it's $2,800. And if you go for an extra to make it look good, over $4,000.
Oh, well, I think I'll.
So I think the liposuction is like the old-fashioned liposuction is probably the same price. I mean, if they do the tummy tuck.
Yeah.
Well, tummy tuck would be when they're taking away the skin, but if you're doing the liposuction, it's a little bit more expensive. But yeah, you know, you get results right away. I mean, by the plastic surgeons.
Yeah.
So anybody who does not want to go under anesthesia, well, they're doing it without anesthesia anyway. I think there are a lot of doctors they're doing it under like just a regional anesthesia. So you, depending on how much you want to invest in your body, but I have seen some patients of mine, they have done it. They have gone to Tucson. Well, gastric bypass is one of that. I think most of the patients I have seen, either I have recommended them because the weight loss wouldn't work for them and they're just literally dying under their weight. One of the young guys I had it, and he was almost 500 pounds and couldn't stop eating, you know, and tried for almost a year. And I said, listen, if you don't have your weight loss, you're not going to make it your next 10 years. You're going to just die. It's simple maths. He was having heart failure and everything. So, but the thing is, I have seen at least 3 patients this week from the complication of gastric bypass surgery. It's like unbelievable. One patient actually have a J tube, like a tube in the stomach now, because the junction of the food pipe and stomach has shrunk, cannot eat anything. So I inherited him from another practice. When he came into me, he was like walking dead. I mean, it was so bad, swollen, anemic, short of breath. So we worked on him, got him all the right thing. Eventually we had to say, okay, we got to eat because you're just malnourished so bad. So we had to put the tube in. Now he can feed himself, but he's back to normal, he's working. Again, these gastric bypass patients are those patients which were the early adapters, who did surgeries when it started and they didn't know the side effects and everybody was just jumping on it. But now they do gastric sleeve, which is a lot more gentle, less side effects. So the point I'm trying to make is that, you know, you never know when just something starts new, what are the outcomes 10-15 years down the road when it's old. And I have seen some patients who have done surgery in Mexico and they have good results, and I've seen patients who have done surgery in the US and they have bad results. So I think it depends on not the country, but I think the surgeon and the facility. So you have to make the right choices and make it fine. Question?
And have you seen any results from our friends across the border?
Exactly. So one of our associate, Dr. Muzica, she does a lot of volunteer work in Mexico, and she went to a hospital in Mexico to meet a doctor who does a bariatric surgery, and she's very careful. She would, you know, go extra 5 miles for her patients, just like all we do, but she go 1 extra mile. So she did go to Mexico, check that hospital, check the doctor, facility outcomes and everything. And I don't have the name of that facility, but she recommended that one person to the hospital, and I think the issue is the regulation. In US, everything's more regulated, so you can really be more confident. Other countries, which are third world countries, where it is hit or miss, I guess. You have to know who's real and who's not real, and choose it wisely, because you don't want to put yourself under the knife without doing your homework. So generally speaking, the same thing goes for pharmacies, dentists. Really, nothing is. It's all up in the air. I mean, you can't really tell what's happening because there's not a whole lot of government control there. I have seen a patient who was almost going to die from pneumonia. I'm like, okay, dude, I'm giving you this antibiotics and nothing is working. Then I happened to ask him, where are you getting your medication from? He said, from Mexico. I said, okay, spend some time, some money, and just buy it from Walmart in the US. Let's see what happens. And dramatically got better within a few days after that. So obviously those antibiotic was fake, you know. I mean, a few medications you can work with and you can tell, like pain medications, you know, okay, your pain go away, you know it's working. Blood pressure medication, pressure drops down, okay, it's working. Or diabetic medication, if your sugar is getting down, it's working, right? Life-saving medication, antibiotics, you don't have time, right? So if you have bad infection and you're just experimenting it, and you wouldn't have reaction time to figure it out what's not working. Now coming to surgery, the same thing. Once you're under the anesthesia, God knows what's going to happen when you come back. So do your math. Again, I'm not saying anything against it. I'm just saying it's regulation issues. There are good doctors, there are bad doctors. I think just like any country, it's not just one country or the other country. For example, in US, all the medications, the medicines, when we call them medicines, they are FDA approved, right? They're under FDA. So it's very difficult to get FDA approval. So all the medications you get, and still you see the bad outcomes, right? But all the supplements, they're not FDA approved. So there's no FDA regulations. I can make any supplement, name it anything, and sell it, and nobody can say anything. And you see the difference, like when there's no regulation involved, then those supplements can claim anything what they are selling, and it might not do what it's supposed to do, but they can claim it. And they get into trouble eventually for other things, or FTC, you know, other agencies will get involved, but that does make a difference if it is controlled or it's not controlled. So in other countries, and it doesn't happen, it has to be Mexico, it could be Pakistan or India or any other country, you know, China, you know. I mean, there is stem cell centers which are all over in the world now, and they claim that they will inject their stem cells into your bloodstream from a young guy to not a young person, and they will get younger in a few months, but it's going to cost you $30,000. And they were doing in US, and then they shut it down. All the feds got involved, and they shut it down because it was not true. There's some indications where you can do the stem cell transplant, like in back surgeries or knee injections. But those clinics are still in Tijuana and the Philippines, other countries, obviously, because there's no oversight, and a lot of people do invest. They travel internationally and spend that money, and I advise against that. That's where we are. Good questions. I like this session today.
When do we get to see the rest of your crew?
Rest of my crew is everywhere. What kind of crew are we talking about?
The weight loss.
Oh, yeah. Where's Julio? Where did they disappear? And Renee, they're out there. Can you get them in there? So my weight loss crew is very limited. It's generally me, and they work under my supervision. We just, I think they got pretty good at doing what they do. They want to see my crew, and I said, "Here's his."
I was eating everyone's food when you weren't looking. I'm sorry about that. There's not enough snacks now.
He's on negative weight loss program.
I'll be the ninja and I'm sneak a couple of calories.
So one time I said, okay, I'm going to do a competition, and I don't know what he's going to say. You know this new Alexa device, which
Yeah.
son here, he asks him all the time, tell me a joke, right? It's an Amazon device. It gives you, you can ask different things, tell you different things. So we generally ask, so tell us a joke, and Alexa will tell us a joke,
You're
So-
saying he's your Lexus.
That's what we're going to check it out. Julio versus Alexa for jokes.
Call me Betty.
Well, give us a joke, make sure it's not racial, and make sure it's not that one.
All right, here we go. 3 stories in the air. This guy was in the corner all pissed off, and the new guy walks in and noticed that he ordered a special beer. He flew around the building 3 times, came back in. Well, that's some special beer. So that special guy went to the bathroom. He's like, you know what? I want a special beer too. Are you sure? Yeah, all right, cracked it open. And he drank it fast like me. So it started to kick in, my teeth started to go numb. With special beer, so I jumped out the window. I died. And that special guy came out, he sat in the corner, all pissed off, and the bartender was like, you can be a jerk sometimes, Superman.
So, the last time we had another guy from Phoenix, he couldn't make it or was too much driving, so he used to say jokes. I said, okay, well, maybe we can use Julio for that now. Thank you, Julio. Alright, so here's my crew, so you met it. Anything else? And Danny's my son. Come on in, Danny.
Now, is he fixed to take over the...
Well, I think he's my help me out when I'm working in my home office. So
Protege.
yes, he's 9 years old, son, Danny, and he's a martial artist. He's a dancer. He's a musician. And what else you are? Is some another skill set is learning. I don't know what.
You're going to have to watch up some girl chasing around want to capture.
Here you go. All right. Are you green belt now?
I'm the adopted son.
It wasn't in foster care. All right. Anything else?
Thank you.
All right. Thanks so much. So keep the date in mind for next time. Nice questions. Thanks for coming in. Enjoy the lunch. And have a nice day, guys. Thank you.
Thank you.
Thank you.
Thank you.